The American Society of Anesthesiologists finally released a statement on the management of patients taking Ozempic and drugs like Ozempic. Ozempic is part of a category of medications called GLP-1 agonists. GLP stands for glucagon-like peptide 1 receptor agonist, and they were originally designed for people with type 2 diabetes. In the case of type 2 diabetics, these drugs are designed to help increase the secretion of insulin into the bloodstream, which helps regulate blood glucose levels. They have an interesting side effect, however, of slowing down gastric emptying, which leads to people feeling fuller and has been associated with weight loss. So this is where Ozempic and drugs like Ozempic have gotten very popular for people trying to lose weight. As a result of this delayed gastric emptying, however, we have noticed in the anesthesia community patients coming in on these medications with full stomachs. And there's been case reports in the literature popping up of patients aspirating, meaning vomit getting into their lungs. When someone comes to the operating room for surgery, we do an assessment of every patient of whether we feel that they're at a high or low risk for aspiration or not. And that often determines the type of anesthesia we give you, the way that we secure your airway, and even the way that we induce general anesthesia. So as Ozempic has had a rise in popularity, there has been zero guidance up until this point on how to manage patients. Do we go about our normal decision tree? Should we encourage patients to skip their dose for surgery? Do we need to treat everyone like a full stomach and assume that they're a higher risk for aspiration? Well, the American Society of Anesthesiologists has released a statement finally. For elective procedures leading up to the procedure, if you are on daily dosing of one of these types of medications, consider skipping your dose the day of surgery. And if you're someone who takes a weekly injection, then you would skip your injection a week before surgery. If you are a patient using this medication for the management of diabetes, it's also recommended that you talk to your endocrinologist about how to best manage your blood sugar in the meantime. On the day of surgery, if you're having any symptoms, nausea, vomiting, bloating, abdominal pain, we might want to consider actually delaying your procedure or canceling it that day. It's not worth the risk of you getting vomit in your lungs. But if you skipped your last dose and you don't have any symptoms, we can proceed as normal. If the patient has no GI symptoms, but the last dose was not held, proceed with full stomach precautions and consider using an ultrasound to actually measure gastric volume. We actually did this last week with a patient. We did evaluate her stomach contents with gastric ultrasound, and it wasn't totally full, but she did have some food in it. So we did end up doing an RSI, a rapid sequence intubation, to protect her airway. It's important to note we don't have a lot of data on this still. This is just the current recommendation released by the ASA. As always, this is information, not medical advice.